Balalala.
A sexy motherfucker.
Baby, I'm just gonna shake, 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 shake. I shake it off, I shake it off. To fly. No.
Come feel my heart, it's beating like a drum, and I confess, when you're around, it's like an army's marching through my chest. And there's nothing I can do, I just gravitate toward you. You're pulling on me like the moon, I just wanna get you sideways. I'll sing anything I can to give me more than just a dance. Tell me where to put my hands. You know that you could be my favorite one night stand. You get me higher. What would you do if I told you that I loved you? Do if I said it tonight? What would you do if I told you that I loved you?
Other videos about first aid. Enjoy!
Hey guys, today we're going to talk about something that is really important if you handle firearms or edged weapons or different things. We're going to talk about treating gunshot or knife and puncture wounds today. And Skinny Medic and I have gotten together and we're going to create this video to show you a first responder type response to an injury like that could be, you know, miles away from help or in the field in a very critical situation. Now, Skinny Medic has been an EMT or a paramedic for 7 years, and he does a lot of instructor courses in the field. So, what instruction courses do you teach?
I teach EMT Basic, I teach First Responder,
I teach advanced cardiac life support, I teach a pediatric advanced life support, as well as first responder and CPR.
So that's the reason why I wanted to get Skinny Medic together and talk about this very important issue, especially in a survival situation or just an everyday first responder type situation.
And you know, Stooge, we never know when we're going to be that first responder. This could be out in the wilderness, or this could be at the mall.
That's right.
Here's some of the things that you might need to take care of a gunshot wound, stab wound, puncture wound, one of those things. First thing and foremost is we want to have some gloves on, because you don't know what the patient might be carrying as far as diseases. You don't want to get blood all over your hands. So try to have a good pair of gloves on. With anything, we've got to have bandaging. Is to control bleeding. We talked about in my how to control bleeding video that all bleeding stops eventually. So we need to try to get it controlled very quickly. So we want to have plenty of bandaging to get this under control. Also, you see I've got a plastic bag here. This is going to be some of your chest injuries. We're going to talk about that a little later in the video. For your puncture injuries, we're going to have bulky dressing as well. We've got a couple of different types of bulky dressing, and also some tape is always handy to have. Like Sush was saying, I've worked for a busy 911 system for 7 years now. I've seen my share of gunshot wounds. So this is just some basic tips on how to take care of someone who's been injured by a gunshot wound. First off is we've got our gloves on to try to protect ourselves and protect the person as well. With a gunshot wound, you're not going to know where the bullet has traveled once it's entered into the body. So we want to keep the patient as still as possible. During this, I'm going to hold Chooch's head still by just placing 2 bags on either side of his head, just to help remind him not to move his head. Starting from the head, working our way down, if you've got someone with a gunshot wound to the head, it's going to be very vascular. I mean, it's going to bleed a lot. So a lot of bulky dressing is going to be what you're going to use to control this. By direct pressure and holding it. Don't keep moving it off, and just keep holding it. Working our way down, if you've got someone who's been shot from the neck all the way down to the lower rib cage, that has the possibility of being a sucking chest wound, meaning that there's a hole and air is going to be rushing in and out of it. When air is rushing in and out of the chest cavity or the neck area, it's not going to the lungs. It means your patient can get hypoxic, their respiratory rate is going to start decreasing, and they can go into respiratory failure unless you fix it. One of the simplest and easiest way to fix this is simply by putting a gloved hand over the injury. When he breathes in, it's going to create a suction there and stop air from rushing in. So, easiest way to fix this, put a gloved hand on there. Once we get it fixed, I'm going to show you a cheap, easy way to fix it temporarily if you're out in the wilderness, unable to get to help very quickly. Take a plastic bag. We're going to cut this one. That's why it's always good to have a good pocket knife on you. This isn't the most sterile, but in the wilderness, when you can't get to help very quickly, this is going to save your life or your friend's life. Take this plastic, and once again, make a seal over where the injury is. Now, to keep it in place, we're just going to tape it down on 3 sides. You tape it down on 3 sides so when he takes a breath in, it's going to suck to his chest and seal. When he takes a breath out, it'll release and it will let air come out so he doesn't get further injury. Just using some simple tape, and we're going to tape this down. Now, of course, we would have removed all of his clothes from where the possible injury. We wouldn't tape this on top of his shirt. There we go. That is how we treat a gunshot wound to the chest. Also, remember that the lungs are on the back side. So if you get a gunshot wound to the back, this is going to be the exact same treatment, you're just going to do it on the back. With a gunshot wound to the abdomen or pelvis, you're going to want to control that with bulky dressing like we've done before. Take a bulky dressing pad and apply direct pressure. Don't keep removing it, just keep adding on top of it. The next part we're going to talk about is say Such has been shot in the arm. We're going to talk about how to control bleeding to the gunshot wound to the arm. Simply, once again, apply direct pressure. And if that doesn't control the bleeding, then we're going to go with our bulky dressing and put a bulky dressing to the arm. If that doesn't control the bleeding, then we'll have to go to a tourniquet. I'm going to show you quickly how to tie a tourniquet. Tying a tourniquet can be one of the most effective ways to control bleeding if you're out in the wilderness and it's going to be an extended time before you can get help. So I'm going to go through, show you how to tie this tourniquet. You want to apply the tourniquet just above the site where the bleeding is. Use a wide bandage. Just make a simple overhand knot. Take a pin or something straight that you can rotate to tighten this up. Once again, another simple over the hand knot. And because Such is my friend and I don't want to hurt him, I'm not going to tighten this up. But you would begin to rotate that. You rotate it until the bleeding stops, and then you just secure the pin tightly so it doesn't unravel. Remember that applying a tourniquet is a last resort. There is a possibility that this patient could lose his extremity. The danger with knife wounds and puncture wound is you don't know how far the knife has went into the subject. For instance, it could be a little small 2-inch knife, or it could be a knife as large as this. So we don't know how far and what organs may be involved. So we do not want to remove the object, whether it be a knife, a tree limb, anything that's protruding into the body. We do not want to remove it. We want to stabilize it in place. This may be controlling bleeding, so if you remove it as well, you're going to not be able to control bleeding. We're going to say Such has got a stab wound to the sternum. We'll just pretend like his wife got really mad at him. So we first off don't want to remove it. We're going to stabilize it in place. Take bulky dressings, just pillows, anything you can use to help stabilize it. If your patient's awake, they can hold it, but don't want to remove it. Once we've got it stabilized, we would just tape it down to hold it in place.
Now, what about quick clot or those things that can stop the bleeding?
There are some advantages to the quick clot. When they first came out with it, it was causing second-degree burns inside the injury. So they kind of went away for it for a little bit, but now they're starting to come back to it, and it's not causing the local burns like as it was. And a lot of the military, police officers, SWAT teams are using it to help control bleeding.
But now you as an EMT or a paramedic, y'all do not use it.
No, we do not carry it on my ambulance.
This is not meant to replace medical attention by a professional, so please get in touch with your medical doctor, get to the hospital immediately after suffering one of these injuries. But this is just for you to take that first response, and you could possibly save someone's life by using just a few simple ideas that we've shown here.
Like Such was saying, this isn't a video to give you every single detail on how to treat a gunshot wound or a knife wound or some type of puncture wound. This is just the basics of how to help someone very quickly. And of course, the first and foremost thing that I want to do is call 911 as quickly as possible to try to get help coming to you. I also would like to encourage you to take a first aid class. American Heart offers first aid classes, they offer CPR classes, and usually they only take about 1 day. It'll be very, very helpful for you.
As always, thanks for watching. Please subscribe for more fun gun reviews and sensible survival. God bless America. Long live the Republic.
Accidents happen. It's a fact of life. Are you prepared to be a first responder? To provide emergency first aid until professional help arrives or until you can get the victim to the hospital? This program details everything you need to know to be an effective first responder to individuals suffering from slips and falls, car accidents, cuts and bruises, head trauma, cardiac arrest, or blocked airways. Now you can be prepared. The information you're about to see is being presented by Mr. John Klatt, president and founder of American Safety. Started in 1995, American Safety provides a wide variety of safety training programs for healthcare professionals, businesses and individuals. Additionally, Mr. Klatt trains United States military personnel in the latest first aid and tactical first responder techniques and has traveled in this capacity to the Middle East on several occasions. Now, it is my honor to present to you Mr. John Klatt with Basic First Aid.
Hi, thanks for joining us. My name is John Klatt, and this is Basic First Aid. Every day, tens of thousands of people are injured, even killed, around the home, at work, or at play. And emergency medical services may be minutes, even hours away. The steps that a first responder takes in those first few moments may mean the difference between life and death. In this video today, we're going to show you how to provide first aid for illnesses and accidents. And we're going to give you some first aid tips to help you stay safe if you are a first responder. But first, are you at legal obligation to help someone? Every state has Good Samaritan laws. Good Samaritan laws are laws that protect you in the steps that you take as a first responder. Make sure that you check with your state and local laws before providing care for somebody who you don't know. If you're a member of a workforce rescue team, you may be required to take a blood-borne pathogens course. Blood-borne pathogens is regulated by federal, state, and local laws. Make sure that you check with your employer before becoming a member of one of these teams. Okay, so let's get started. The first thing you need to know about first aid is safety. That is scene safety. Scene safety is there busy traffic, a fire, smoke, gasoline, or other people at the scene? You need to ensure that the scene is safe before you and other rescuers can approach. Once you feel that the scene is safe and there are several victims, you'll need to perform something called triage. Triage means to sort. That is, if there are several victims, you'll need to prioritize each victim and the level of care that they need. If somebody is in cardiac arrest, secondary to trauma, it's very unlikely that you're going to be able to resuscitate them. And spending a lot of time trying to resuscitate one person may not be beneficial in that others may benefit from your care. Another part of scene safety is personal protective equipment. That is gloves and goggles. You may need those to protect yourself against blood and other body fluids. And now to allergic reactions. Allergic reactions are reactions that your body have to snake bites, spider bites, ant bites. It can also be to products like soy products, monosodium glutamate or MSG, or peanut oils. Allergic reactions can stem from trouble breathing, hives can break out, airways can start closing down. So in this scene, we're going to treat Lori here, who's just been bitten by an ant, and she's going to have an allergic reaction. Now, when you approach somebody, you want to make sure that you identify yourself and tell them that you're a first responder and you can provide care. So I'm going to come up and I'm going to say, "Hi, my name is John. What's your name?"
Lori.
It's Lori. Lori, what happened today?
I was working in the yard and I'm highly allergic to fire ants.
And did you get bit?
Yes.
So if she said that she got bit, if you can find out what sort of animal bit her or insect, it's a good idea to go ahead and note that so that you can tell first responders or medical personnel what's going on here. So Lori's been bit and we can see that she's starting to breathe really fast. So an allergic reaction, she could have shortness of breath, her heart rate can be picking up, she may have sweat building up around her brow hair. And then if you notice right here that she's got these red blotches here in her neck and on her chest here. She's having difficulty breathing, and these people that are having allergic reactions may be leaning forward or leaning over something to help them breathe. This is in one case where you don't want to really have somebody laying down because it makes it more difficult for them to breathe. So Lori's having difficulty breathing. We're definitely going to call 911 on this one. I'm going to send somebody to call 911, or I'm going to call 911 myself. And then I'm going to come back and treat Lori here. Now I want to know if she is on any medication. Some people are on what's called epinephrine or an EpiPen or injector should they have allergic reactions. So Lori, are you on any medication for this?
Yes, I'm supposed to carry an EpiPen.
Okay, and where is your EpiPen right now?
It should be somewhere near.
Somewhere around here. So if you can get to that epinephrine pen, you want to grab that right away. And here's the EpiPen right now. This particular pen here injects epinephrine through the leg into the skin here. And the way this works is it's usually in a plastic case. And what you'll do is you'll unscrew the end of the plastic case. It could be yellow or orange. You'll drop the pen out and pull the back piece off. When you pull the back piece off, this will release that injector right there, and I can go ahead and inject this. Now you want to make sure that your state and local laws will allow you to assist Lori in administering this medication. If you're not allowed to administer this medication, she's going to have to help herself. So if you can hand her this pen and have her administer it herself, you should do that. If your law allows you to do this, you may assist your victim in doing this. So the only thing I can do right now is put her in a position of comfort, sitting down so she can breathe like this. We've called 911, and I'm going to take this epinephrine pen and I'm going to go ahead and inject epinephrine into her leg. When you push it in, it's going to click, and you want to hold that for about 5 to 10 seconds. After 10 seconds, pull the pin out. The needle will still be exposed. You want to put it back in the plastic case and screw the lid on there, and make sure that that stays with Lori so that when she goes to the hospital, they know that she's had this epinephrine administered. Some people will actually need 2 injections of epinephrine. So some of these pins are what's called double injectors, in that you will be able to inject it once, pull it out, and inject again and give the second dose. It'll indicate that on the pin if that's what it is. All we can do now is help Lori breathe. If we have to loosen clothing around her neck, we can do that. Again, we want to make sure that she's away from danger, make sure she's away from the ants here, and that 911 has been called. As I said, other things that can cause allergic reactions are soy products, peanut oils, some bushes, fire ants, as in this case with Lori, and also bee stings as well. Now this medication, epinephrine, is a prescription-only drug. It's not something that you can purchase over the counter. So if you know that somebody has an allergic reaction, you want to make sure that they know that they can get this via a doctor's prescription. If you do not have epinephrine and someone like Lori is having an allergic reaction, an alternative to epinephrine may be Benadryl. We use liquid Benadryl because it absorbs in the body faster. Benadryl works because it's an antihistamine, and typically when people are having allergic reactions to plants or soy products or even latex products, they'll build up histamines, and Benadryl will help that as a histamine blocker. But again, make sure that your state and local laws allow you to provide these medications to the victim. Let's talk about accidents. Robert has just fallen off his bicycle here. Now, if he was in the middle of the street, scene safety is paramount here. You need to make sure that the scene is safe before you approach Robert here laying in the street. So you need to be aware of traffic and other people as well. Now, we don't typically move people that have fallen off their bicycles with possible neck injuries, but in a case where this was a busy street, you would want to move Robert out of the street right away. If you have several people that can help you, that's great. If you don't, you have to move this person because the scene has to be safe. So in this case, we look at something called AVPU. When we walk up to somebody, AVPU, the A stands for are they alert? So if I go up and I see this person and I introduce myself and they talk to me, they're alert. V is, do they have response to voice? Maybe they don't acknowledge me, but when I talk, they can move around. That's voice. P is response to pain, and that is they may be unconscious, but when I rub them in the sternum here or I pinch them up here, that they move when I do that. And then U is unresponsive. If they're unresponsive, we need to do a quick assessment and find out what's going on with them. They may have head injuries, they may have leg injuries. Another priority that we need to do in an accident like this is look for bleeding. We can come up and hold Robert's head. We can go down and look what's going on with all the bruises. But if we see bleeding, we're going to address that right away because somebody can bleed to death pretty quick. So you need to address that as soon as you get on scene. So here, I'm going to approach the scene. I'm going to make sure the scene is safe. And the first thing I want to do is, because he may have been hit by a vehicle, he may have fallen off his bicycle, my main concern is that he might have a head injury or a neck injury. So when I first approach Robert here, I'm going to come up and I'm going to tell him who I am. Hey Robert, my name is John, I'm a paramedic, I can help you. And I'm going to hold on to his head. If somebody's wearing a helmet, there's no reason to remove it. It may be helping hold his brain here in. So we want to leave the helmet on. If there's bleeding and you have to remove the helmet, or you have to do CPR on somebody, then you may need to remove it. But right now, I'm going to hold his head inside this helmet. I'm going to ask him if he can hear me. Can you hear me? Can you hear me, Robert?
Yeah.
Yes. Okay, what happened to you?
I fell off my bike and got run over.
He fell off his bicycle and he's been hit by a vehicle. And asking those questions, they may be basic questions, but they let me know that he's alert and that he's doing well. He's doing pretty good. I'm going to be looking how he's breathing, see if he's breathing fast, if he's sweating. When somebody goes into shock, they're going to be sweating and they're going to be breathing really fast. And so we need to address that, and I'll address that in just a few moments. So I'm going to look down at Robert and see if there's any bleeding. I don't see anything right now, but again, if there was, I would address that immediately. I have somebody else that can help me, and I'm going to have Stephanie hold Robert's head here. Now, I've sent somebody to call 911. If you're alone and you have to call 911, you'll have to leave him. You'll have to tell him to keep his head steady. You don't want them to move their head back and forth because it might make the injury worse. But now I have another person here, another rescuer, that can help hold Robert's head, and then I can start a head-to-toe assessment. 911 has been called. There is no bleeding, and I'm going to ask Robert if he hurts anywhere. This is called the chief complaint. I'm going to go ahead and move this bicycle out of the way here. Robert, do you hurt anywhere?
Yeah,
Where do you hurt?
on this big bruise.
On the big bruise down here. So what I'm going to do is I'm going to go down there and address these bruises. On this leg right here?
Yes.
Okay, so what I'm going to do is look and tell me. You're talking about right here?
Yes.
So what we want to do is we want to address this leg first, because that is his chief complaint. Now when I'm looking at this bruise, it could just be a bruise, which is internal bleeding, or it could actually be a broken leg. The three ways we determine if somebody has a broken leg or a broken arm or hand is mechanism of injury. Now that is, Robert fell off his bicycle and he's been hit by a vehicle, and that could certainly lead to broken bones. Number two is swelling. If Robert has a swelling area right here, and it does look like it's swelling, he could have broke it. And number three is point tenderness. And that is, if I touch this, does that hurt when I touch this? So I'm not going to touch it anymore, but I might immobilize this leg. We might splint his leg using sticks or towels or phone books, or any way that we can. We may do that to prevent movement of bones. When somebody has broken a bone in their arm or their leg and it moves around, there are blood vessels inside, and when those bones move, it could very well break those blood vessels and he may bleed internally. As a matter of fact, this bruise right here is an indication that he is bleeding internally. The bruise here is due to bleeding inside his leg, and as the blood leaks out of the blood vessel, it turns dark or black or red like this. So I'm going to go ahead and address this. We may splint this area here, which we're going to show you later. I'm going to ask you, does this leg hurt right here?
No.
Okay, good. Then I'm going to go ahead and straighten out this leg. Let me know if that hurts here, and I'm going to go ahead and straighten that out. Now, I've addressed this. I'm going to make sure that he immobilizes his leg and he doesn't move it. I'm going to address from head to toe, make sure that there's no bleeding. And now I can go back and start at the head and work my way down. Some of the signs we see that somebody has been injured can either be blown pupils or fluid coming out of the nose or ears. This fluid is called cerebral spinal fluid. Now typically what happens is if somebody has a head injury, the brain swells and it will push this fluid out of the nose or ears. Do not stop this type of bleeding because the brain is swelling, and if you close this off, it's going to put undue pressure on the brain. We can also look at Robert's eyes here. We're going to look at his pupils. If those pupils are equal, if they're the same size, that's a good sign. If one has blown or it's bigger, it could be a sign again of head injury. So we want to be aware of that and note that for the emergency medical service when they get there. So I'm going to look around the head for bleeding. I'm going to look in his nose. I'm going to look in his mouth to see that there's any broken teeth. Any broken teeth in there? Do you hurt anywhere in your mouth?
No.
Nope. I noticed that he has a bruise right here. That's something that's very, very important to indicate here. I'm going to check his shoulders. Now when you check for broken bones or dislocations, you want to look at the top here. Typically what happens with children when they fall off their bicycle, they'll put their hand out like this. And when they put their hand out, the shoulder will come up, the big bone here called the humerus, and it will move up high, and you'll see a divot in there. So I want to check for dislocated shoulders. I'm going to come down, and I'm going to palpate. Palpate means to touch. When I check Robert for broken bones, what I'm doing is I'm wiggling his arm back and forth, and I'm making sure that his bones are nice and sturdy, and I'm making sure that there's no bleeding, and I'm also taking note as to whether he has any pain or not. Now, when I get down to this arm here, and I get down to his hand, I can do a couple of quick checks here. I can actually take one of his fingers or his thumb, and I can press on that thumb, and the thumb will turn white, the fingernail, and then I can let that go. If blood returns to the fingernail after 2 seconds or less, this is an indication that Robert's got good circulation. That is, he's not going into shock. Typically in shock, the blood will pool to these areas, and this capillary refill will be longer than 2 seconds, 3, 4, or even 5 seconds. So I can certainly see that his fingernails are doing good and that I push the blood out and it returns back in 2 seconds. Robert, do you feel me touching your fingers here?
Yes.
And that's a good indication as well. He can feel me touch his fingers, and that's telling me that he doesn't have any nerve damage in this area here. So now I'm going to go down through the chest here. I'm going to look at his stomach, make sure that there's no bulging or anything like this. If there's any bulging in the stomach, that could be an indication that his muscle tore in his stomach and one of the large organs is trying to press out. I'm going to do the same thing with the other arm. I'm going to come down, I'm going to palpate that arm here, and I'm going to check capillary refill on this hand. And then, do you feel me squeezing your finger? Perfect, he does that. And now I'm going to do the same thing with the leg. Now I'm going to be very careful about the uninjured leg, or the injured leg I should say, in that I don't want to hurt him any worse, because that will increase anxiety. So again, I'm going to go down, I'm going to make sure that this leg, just let me know if this hurts here. And then what I can do is I can ask Robert on this uninjured leg here if he can push down on my hand. Go ahead and push down. Perfect. And then I want you to pull up. Now by doing this, by having Robert push his foot down and pull it back, this is also letting me know that he has got no nerve damage, in that his spinal cord, his brain, everything is working well, and he's able to move his toes, move his foot back and forth. And, of course, do you feel this as well, Robert? Do you feel me squeezing your toe? So he feels that. So our best course of action right here is that Stephanie's going to maintain this spinal immobilization on Robert's head. We're going to immobilize this leg because of a possible broken leg. We can't treat any bleeding because Robert's not bleeding, and all we can do now is comfort Robert and wait for the emergency medical team to get here. So when we're back to Robert here, if we think that he broke his leg, the best course of action is just to keep it immobilized until emergency medical services get there. They've got the professional splints, the inflatable splints, that they can immobilize this leg, immobilize Robert to a board, and transport him to emergency services. But if you have time or you're camping and you can't get emergency medical services up to you, you may have to do something. You may have to invent a splint. Certainly it's simple enough to purchase a splint. This is called the SAM splint right here. The concept of this splint here is that it's aluminum with padding around it. And what you can do is you can just fold this over and make it as rigid as you want, and you can run this along the broken bone. Now the idea of splinting is to immobilize the bone so that the bones don't move back and forth and cause any further damage and also pain to your victim. So the concept is that when you splint somebody, you want to immobilize the bone or joint below and the joint above. So if we thought that Robert broke his leg right here, which is the tibia and the fibula, and then this is the femur right here, if we thought he broke a bone here, we want to immobilize his foot all the way up to his hip. And the same thing if he broke this bone right here. So what you would do in this case is you would make this as long as possible. You could put this on the inside and wrap it around his foot. You always want to splint bones and legs and limbs where they lie. So if he had broken his bone, and let's say that it had turned out this way, you don't want to straighten it out. You never want to move that part. You always want to splint it. And if you have to use padding to splint this, then that's what you want to do. So you want to move it as little as possible because there'll be great pain, and also it can cause bleeding. So we can use the SAM splint and put it in this way. Now certainly if you don't have something like this, then you can use something that you can find around the house, whether it be towels or phone books or blankets or even sticks in the backyard that I'm going to show you here in a moment. You could even use the other leg as a splint. If you're going to use the other leg as a splint, you want to pack towels in the center here. You want to put towels here because what's going to happen is if I use this leg to splint this leg, I'm going to move this leg over towards, so you always move the unaffected leg over towards the affected leg. And then the towels will help fill in the gaps here. And then what you want to do is you want to tie these two legs off. Keeping in mind, of course, if you're camping and you need to get out of there and you splint both legs, it's going to be difficult for Robert to walk. So sometimes it's better to use other splinting material. So in this case, I'm going to use a stick that I found out in the backyard. Now, if I see that he's got this injury right here, I always want to place the splinting material on the opposite side because you don't want to put the splinting material on top because obviously that's going to cause a lot of pain for Robert. So I'm going to go ahead and put this stick in the center here. And then what I'm going to do is I'm going to take some wrap material here. I'm going to take some gauze or triangular bandages. I'm going to move this here first. And I'm going to go ahead and set these under his leg. Now notice that I'm taking these triangular bandages or these bandages and I'm sliding it under his knee. There's a natural gap underneath his knee so you don't have to lift up his leg. And what I'm going to do is I'm going to scissor these down into different parts of his leg so that I can use to secure the splinting material. So I'm going to go underneath here, and then go up here. And I'm going to make sure and secure this in at least 3 different places. It's very important to make 2 ties right where that break is as well. So I'm going to take note where this is, and I'm going to go up a little bit higher so I don't go on that break. Now I'm going to go ahead and put my splinting material in there. And then what I'm going to do is when I place this down here is I'm going to make the tie. Now you may want to run this around the leg 2 times. You can actually make two passes around the leg. And then when you tie this off, you want to actually make the tie right on the side of the splinting material. And the reason you want to do that is because if I make this tie up here, it's going to put pressure on his leg. So the tie or the knot should be right on the piece of wood or phone book or blanket or material that you're using. So I'm going to go ahead and make these ties here. And then the second one is going to be here. And again, you may want to loop this around 2 times to make sure that it's going to be secure. So I'm going to make that tie here. Are you doing okay, Robert? Yes. Okay, good. You always want to talk to them. Let them know what you're doing. Don't surprise somebody with something that you're going to do, especially when they're this age. They have a lot of anxiety. They want to know what you're going to do, and really they want to know if it's going to hurt. Now that's something I can't really tell them because I don't know if it's going to hurt, but you want to be careful anyway. So I'm going to make a couple of ties here. Now that I've immobilized this leg here, I should take the pressure off of him moving back and forth and maybe make a little bit of less pain for him and actually a little bit safer as well. Now after you make this splint here, you want to make sure that he still has feeling in his toe. When I did the initial assessment, I found that he could feel me squeezing his toes and his fingers as well, and he had good capillary refill. Down here on this foot here, I want to make sure that he can feel his toe still. And the reason I want to do that is because once I put this splinting material on there, I want to make sure that I didn't do something that's going to cause him not to have feeling in his foot. So once you do something, check it out. Make sure that he's still got feeling and things are still working good for you. We might even take Robert's sock off and check capillary refill. Now because he broke his leg here, I would expect him to have a delayed capillary refill here, in that the vessels may not be circulating as well through this leg. So we might expect that when we push his toe, if we take his sock off, I'm going to go ahead and pull this sock off here. If we pull this sock off, we might expect him to have a capillary refill of maybe 3 or 4 or 5 seconds. So always check that before and during and after you do procedures like this. Let's talk about heat exhaustion. Now Lori's an athlete here and she's been running and she may have a case of heat exhaustion. The first thing I note is when I come up to Lori is that she's sweating. It looks like she's in athletic attire here, and that she's sitting down and she's having trouble catching her breath. So same thing, I'm going to come up, introduce myself. Hi, my name is John. Can I help you?
Yes, I think I can't catch my breath.
You can't catch your breath. What happened? What were you doing that you can't catch your breath?
I was running.
Okay, so you were running. And do you have any type of medical problems, any medications that you're on or anything like this?
No.
So we're going to establish that this is not something else, and it could be a heart attack or a stroke or some sort of medical condition that she has. We want to make sure that she is just suffering from what's called heat exhaustion here. So the signs and symptoms of heat exhaustion is high level of activity, of course. She might have what's called an altered level of consciousness. That is, she's having difficulty talking to us. I see that she's sweating profusely. She's hot to the touch. In doing vital signs here, we can do a couple of things. We can check pulses. If we check pulses on the hand here, if you want to see what a heart rate is, you can actually go down the thumb here and check the pulse. Now, on the thumb side of the wrist here, if you put 2 fingers into this area here, you should be able to feel how fast the heart rate is going. A normal heart rate on an adult is around 60 beats per minute. So if you were to check your own pulse and you counted for about 30 seconds and your pulse was 30, you could double that and find that your heart rate is normal. In somebody that's suffering from heat exhaustion, we would expect the heart rate to be somewhere around 100 or 120. So if Lori has given me the okay to treat her, I can go ahead and I can look for obvious skin signs here. I see that she's sweating. She has no medical alert bracelet. Always look for medical alert bracelets that could cue you in as to what other sort of medical condition that she might have. But she said she was running. She's sweating. She looks like she's sweating. She's hot to the touch, and I'm going to check her pulse here. And I note that her pulse is about 50 times 50 beats here. I count 50 in 30 seconds, and if I double that, that's going to be 100. So 100, 120 I would expect if she was in heat exhaustion. Another thing that I note is that she's sweating profusely and that she's breathing really fast. Typically people breathe about 12 times per minute, adults, and children breathe about 20 times per minute. So if Lori's trying to catch her breath and she's going and she's breathing really fast, this is another sign that she's either going into shock or she has heat exhaustion. So what I can do for Lori in this heat exhaustion here is we can do a couple of things. We can, one, take her out of the hot environment. It's a hot day, she's been running, she's sweating. So the first thing I'm going to do is have her get up and move to a cooler environment. Number two, I can give her sips of water. We can have her drink water or some other type of fluid replacement. Never alcohol or coffee or anything that has caffeine in it, because that's a diuretic and it's only going to reduce the amount of water inside their body. So water or things like Gatorade is the best treatment here. And so she can drink those. Now if I wanted to cool her down, what I want to do is, if I was going to cool Lori down, we never want to throw water on anybody anymore. It used to be that when we would cool people down, we could throw copious amounts, large amounts of water in their face and all over their chest. And what they found out is when you're using large amounts of water, it can actually cool them down too fast and actually slow their heart rate down and can be very dangerous. So with Lori here, what I can do is I can just take a few 4x4s or a rag, and I can just get a rag a little bit wet and I can cool her down slowly. I can cool her forehead down, I can cool her down around her neck and around her arm as well. And this is a better way of cooling somebody down. Now, should you call 911 here? Typically when people have heat exhaustion, they don't need 911. If you can sit her down in a cool environment and in 10 or 15 minutes she starts to feel better, her heart rate goes back down, her respiratory rate goes back down, and she tells you that she feels better, you may not need to call 911. If she starts to get worse or she doesn't get better in 10 or 15 minutes, then you'll want to make that call. You know, anytime that we find somebody that has heat exhaustion or has been injured or is ill, they usually go into what's called shock. Shock is a very generic term. When your body goes into shock, what happens is that Once the body goes into shock because of injury, or in Lori's case, heat exhaustion, the vessels will dilate, the blood vessels. And when the blood vessels dilate, a lot of the blood pools down into bigger areas like the stomach. And so what happens is your heart will start beating faster because it's trying to compensate for the loss of blood up in your brain and in the vital organs. So the first thing that happens that we note is the heart rate picks up speed. That is, it'll be anywhere from 100 to 150 beats per minute. The second thing that happens, because there's more blood that needs to be pumped around, the heart goes faster, it needs more oxygen. So your body responds by increasing your respiratory rate. Now Lori may be breathing fast because she's been running, but she may also be breathing fast because she's in shock. So the heart rate's going to go fast, she's going to be breathing really fast. And another thing that we can do to help her out in shock is we could actually lay her down. So if we put her in a cool environment and we were to lay her down, and I'll show you this right now, I'm going to go ahead and lay Lori down. I'm going to put her down on the ground like this, and then what I'm going to do is I'm going to raise her feet 10 to 12 to 14 to 16 inches. And by doing that, by raising the legs, it'll allow the blood to pool that's normally down in her stomach to go back into her vital organs where she needs it. And even a hot day like today, we may even cover Lori up, because what happens is, now that we've cooled her down, she may start to shiver because she's going into that shock state. So the heart rate will be fast, the respiratory rate will be fast, and she may even complain about chills. And in that case, we'll cover her up. So here, if we're going to raise her legs here, because we're not worried about any broken legs or anything like this, we can go ahead and take anything that we find around the house or at work, and again, we can raise the legs 12 to 14 to 16 inches. And then this is what's called a space blanket. This is a very lightweight blanket that you can use or have in a first aid kit. You can of course use any blanket or towels around the office or at home, but something like this is a little bit more efficient because it's designed to hold the heat in. So I'm going to go ahead and open this up, and I'm going to cover Lori up. And I'll cover her up all the way up to her head here. And then I can kind of tuck this around, and that should store all that heat in. And this is a typical shock position. You can do this for anybody that's been injured, that's you feel is going into shock because of illness. The exception to the rule is when people are having respiratory difficulties. In the later parts here, we're going to talk to you about asthma and things like that, where people are having trouble breathing. You would not lay them down in the shock position. So we talked about heat exhaustion. The next thing, or the worst thing that could happen from a heat-related injury, is what's called heat stroke. Now what happens is when you have heat exhaustion, when you have been exercising or working out, your body's going to sweat, and it sweats so that your skin cools off and it cools your body down. So as we saw with Lori earlier with heat exhaustion, she had a high respiratory rate, her circulatory rate, her pulse was fast, she was sweating profusely, but she was able to talk and drink water. So we put her in a cool place and we didn't need to call 911. But now we're looking at Lori, and it looks like she's not sweating anymore. And in heat stroke, what happens is your body can no longer cool itself down. So typically what we see is, and we have to kind of decide what's going on, we knew that Lori was working out. We see that her clothes are still wet, so she's been exercising and the sweat has still saturated her clothes. But when I look at her face now, I note that it's dry, she's not sweating anymore, and that when I use the back of my wrist here on her forehead, that I note that it's very, very warm. When somebody is red in the face, they're dry and they're warm, these could be signs of heat stroke. Another thing that's going to happen is what's called an altered level of consciousness. Anytime you're working with somebody as a first responder, you want to talk to them, introduce yourself, ask them questions, what's going on, how they're feeling. In this case, if I say, "Hey Lori, how are you doing now?" She's not really responding, so she has what's called an altered level of consciousness. So what I can do is the same thing as before. She's still very hot. We still have to cool her down. I'm still going to put her in the shock position, raise the feet. But in this case, I'm going to cool her down, but the most important thing here is we need to call 911. Because when people have heat stroke, they're typically not able to drink any fluids and cool themselves or rehydrate themselves. So you need to call 911 because she's going to need intravenous fluids. So we're going to get her to a cool area, we're going to cool her down, we'll put her in the shock position, but the most important thing we're going to do is call 911. Now let's talk about heart attack. The leading cause of death in this country is heart disease. Every 33 seconds, someone in this country dies from heart disease. It used to be an older, overweight, smoking American that had heart attacks, but we're starting to see heart attacks in younger and younger people here. Chad's having a heart attack. We don't know this yet, but we're going to interview him here in just a few seconds. And then we're going to talk about how to deal with that. Now, in an office or at home, and I noticed that one of my co-workers is having difficulty breathing over here. He's at his desk, he's slumped over. I come in, and Chad already knows me, so I don't have to introduce myself. Hey, Chad, what's going on?
Just a lot of heavy pressure in my chest.
You have pressure in your chest? How long has this been going on?
Maybe 5 or 10 minutes.
5 or 10 minutes. Okay, that's not too bad. Does the pain go anywhere?
Kind of shooting down my left arm.
It goes down the left arm. When somebody's having a heart attack, they'll typically note that they have pressure in the chest. The pain may be localized there, or it might radiate down the shoulders, sometimes up through the jaw and the back. And in fact, females that are having heart attacks will usually not have pain necessarily located in the chest, but they'll have it in the low back, the upper back, and out through the jaw. And they'll also be very fatigued as well. So what's happening here is, in Chad, his heart is not working as strong as it can. Some of the vessels are possibly being clogged with a cholesterol buildup. And so what we need to do is a couple of things. We may have to put Chad down on the ground and put him into shock position. We may need to elevate his legs. We want to call 911. Calling 911 is very important because they're going to have all the necessary equipment to take care of him, give him oxygen. Also, if Chad's having a heart attack, he may be on medication. Typically people that have what's called angina, that is, they have a buildup of cholesterol in their coronary arteries, and they take a medication called nitroglycerin. Nitroglycerin will dilate the vessels and help them breathe and feel better. So I want to ask Chad if he's on any medication. Are you on any medication for this? Nope, he's not on any medication. It's very important that if somebody is on nitroglycerin or on a medication for their heart, that you do not give Chad their medication. That is a prescription medicine, and it is designed for the person that it is prescribed to. So the only thing we can do is make Chad comfortable and call 911. If Chad tells us not to call 911, recommendation is to call 911 anyway. And then what we're going to do is maybe put Chad down on the floor. I'm going to go ahead and bring him down on the floor.
You remember a few weeks ago I did a piece on race-safe marshalling, and I met up with Toby Branford. He was a surgeon, but he gave up his time to advise people on the medical aspects when you find a casualty. But what about if you're out with your mates or even on your own and you come across a casualty on the side of the road, or perhaps one of your mates tumbles off the bike? We've got an unfortunate young lady here on the floor. But first, meet up with Toby again. Hi Toby.
Hi.
How are you?
I'm very well.
Good. Who is this young lady? This is Resusciani, isn't it?
This is Resusciani, that's right. I'm not sure what she's been road testing, but she's not done very well.
Yeah, I don't like the look of that leg either. But
no, nor do I.
One of the most important things that you should do, first off, you were saying earlier, if this was for real, you've got to look out for traffic yourself,
I was going to say, you mustn't put yourself in danger. You mustn't run out into the road, things. So the first thing before you approach any scene is make sure it's safe.
Right.
Approach. No oncoming traffic, so then I can approach you.
Okay, so we've come to this scene. I'm just going to be the observer. I'm not really here, and I should have introduced your colleague as well, Alison. Come over here. Hi. This is Alison Walker, Toby's colleague. So what do we do then? You have come across this unfortunate casualty.
First thing you need to do is, as long as it's safe to approach, is you need to approach her and make sure it's safe and see how she is.
Right.
The first thing you need to do is come and ask her how she is. You need to open her visor, and really it's a case of looking to see how she is and asking, are you all right? If she's conscious and she can talk to me, and it tells me that she's breathing, it tells me that she's alert and hasn't bashed her head too hard, immediately I know she may not be seriously hurt in terms of her other injuries, and she's unconscious. The first thing you need to do, though, having approached her and assessed the situation, is you need help. So the first thing I need to do is get on my mobile, let's call it, and call 999. We've got an ambulance coming, and perhaps I've flagged down passing car, what my colleague says. We need to see how she is. And it's important that I'm not letting her move her neck around, because she might have, you know, she's tumbled off the bike, she's unconscious. I don't know that she hasn't broken her neck. It's very unlikely, but it's important that you protect all of her spine. If she's conscious and talking to me, the important thing is that she stays lying flat. I don't want her moving anything unnecessarily. You need to get the visor open, because you know how steamed up you get, you know, just standing still. If she's seriously hurt, she needs all the oxygen she can get, and you don't really want to be rebreathing your own carbon dioxide with the helmet on. If she's conscious and alert and can tell me that she's got no neck pain, we can help her take her own helmet off, but keeping her lying down. But that would be the first thing. But you do want her to get a helmet off, and if she can take it off herself, that's easy. If she's unconscious and I've got some help, we need to get the helmet off, because the first key in looking after anybody who's seriously hurt is we tend to think of our priorities as ABCs. It has to be a simple thing that I can remember. And our ABCs in first aid are airway, is can you get oxygen in and out so that they're not choking? Are they breathing? It's a good thing to do. And then have they got a circulation? Have they got a pulse? But my main priority is airway, which is the first letter of the alphabet. And with this big bit of Kevlar in the way, I can't tell that she's not choking, that she hasn't got some broken teeth, maybe her tongue's blocking her mouth. And so we need to get the helmet off. And you need two people to do that, and that's why I need help. Alison, can you give me a hand taking the helmet off? Have you done this before?
No, do you want to tell
me? Right.
me?
If you come down here, we need to protect her neck.
Right.
Okay? And what I want you to do is slide your hands around the side of the back of her neck and just support it with your hands either side like that. Just support her neck to stop it moving around while I take the helmet off.
Okay.
Would you come and do that for me? I'll just keep supporting the head while we do that. And again, from this position, I can support the head just as well. This is a way of stopping the head moving around. Have you got the... Can you undo the helmet strap for me now? While I support the head. The whole point is one of us is always supporting her head whenever we're doing things.
What about someone coming across a strap? I mean, bikers will understand, but often people have trouble with bike straps. You advise cutting them off, don't you, if you're struggling?
And certainly on a race circuit, we've always got a pair of shears to hand. And yes, if you've got something to cut it with, it can be quite difficult sometimes. But yes.
Okay.
Have you got control of her neck?
I have.
Excellent. The whole point is one of us always has control of the neck. So if she's got control, we've got the visor open. I can take hold of the helmet. Often just holding it by the straps is good. And I can gently remove the helmet, pulling it back and forth. It's important to remember that you don't wear spectacles, and Alison doesn't, but I do. And remember to take the spectacles off now.
Yeah, good point.
Trying to pull it off with the spectacles in is very difficult. You don't want to watch their nose, but you simply take the helmet off with a gentle rocking motion and pulling, just gently. And all the while, her neck is being supported by Alison. And as the helmet comes off, I can now take that away, and I've now got control of her head.
Right.
So,
could you roll something under?
Absolutely. Because the thickness of the helmet, I don't want to drop her head and for it to fall back. And this is where you often need a pair of rolled up gloves or a jacket or something.
Just anything, just to elevate the head that bit.
But now we've got her helmet off, we can properly assess her, and we're gently supporting her head, keeping control of her neck, and at this point I can look, I can listen, and I can feel if she's breathing, because I can feel her breath on the side of my cheek. And I can feel that she is breathing, and which means that so her airway is okay, she seems to be breathing, and at the same time I can feel with a thumb or finger, I can feel a carotid pulse there. So she's got a good pulse. So she's obviously bashed her head because she's unconscious at the moment. She's got a pulse, she's breathing, and I'm protecting her neck. And we're now waiting for the paramedics to come. And just simply looking after her like that is very good. Sometimes, although they're trying to breathe, you know how your tongue falls back when you sleep, and that makes you choke. Someone who's breathing, there's some very simple manoeuvres you can do to help that. And it's a simple case of pulling the jaw forward. You can put your fingers either side and just push the jaw forward, or you can take a finger and thumb and just lift a jaw like that, or someone else can support the neck while you do that. But a simple manoeuvre like that, or like that, we call it a jaw thrust or a chin lift.
Yeah.
Simple things like that just lift the tongue forward and allow you to breathe much better. And you can look after somebody's neck, carefully keep an eye on the circulation and keep their airway open, simply like this. And if the paramedics arrive, finding you supporting their neck, keeping their airway open and protecting it, and assessing their circulation, if when they arrive they find that, they'll be very happy people and delighted that you've been looking after them so well.